they still asked me to fill out a clipboard with a bunch of forms attached to it.
You were filling out some paperwork in the ER with a dislocated shoulder, and I got the sense that sparked the idea for Yosi.
It certainly did. I'd spent over a decade working in the healthcare space. They said, yes, we understand your shoulder's out, but we need all this information before you can see the doctor. There's still a vast majority of them that use paper. So that's where companies like Yosi Health can not only offer the customization and the personalization that these clinics need. Yosi is today integrated with most of the major medical record systems. Patient intake oftentimes took about 14 minutes per patient. But 14 minutes, if you see 10 patients a day, that's literally 2 hours of time wasted. Yosi Health was the first pre-arrival focused patient intake platform. 83% of patients that were surveyed said we would prefer a clinic that offers the convenience of online booking. Yet 60% of the patient appointments are booked via phone. We're looking to solve for 70% of the phone calls to be fully handled.
You guys recently launched a voice agent. Like, where are you guys headed next as a company?
We're looking at very closely. It has huge implications for improving efficiencies within healthcare.
Hari, thank you so much for hopping on today's podcast. Really excited to speak to you. And for the listeners out there, I have Hari Prasad joining us, co-founder and CEO at Yosi Health. For those that aren't familiar, Yosi is a health technology ecosystem that connects patients, providers, and payers to simplify the care delivery experience. Hari, thanks so much for hopping on today and making some time.
Yeah, good to be here with you, Bert.
Yeah, likewise. So, Hari, let's jump right in. First off, I want to ask you a little bit about your background and this painful experience you actually lived where you were filling out some paperwork in the ER with a dislocated shoulder. And I got the sense that sparked the idea for Yosi Health. Can you fill us in on your background and that story that led you to eventually go start Yosi Health?
Yeah, sure. Thanks for asking. It certainly did. I'd spent over a decade working in the healthcare space, working for both large payer organizations and also provider organizations. So I was very intimately associated with innovation, improvements, and how to make our healthcare ecosystem better. But it was really a personal experience that sparked and ended up being the catalyst for us to start Yosi Health. So I was playing basketball in my friend's backyard. Against all the advices I got, I went for a dunk. My shoulder pops out. And then my friends took me to the ER. And one of the things I was expecting to happen, having worked at a health system myself, was that as soon as I got there, I was expecting them to take care of my shoulder, put the shoulder back in. But what ended up happening was a painful reminder of really the things that we have to deal with as patients accessing healthcare. So they were very, very empathetic, but they still asked me to fill out a clipboard with a bunch of forms attached to it. They said, yes, we understand your shoulder's out, but we need all this information before you can see the doctor. So can you do as much as you can to fill out these forms? So, I was pretty frustrated. I was in a lot of pain with my shoulder popped out, did what I could to fill out the forms. But that episode left me with, a lot of thought after the ER visit to think about, what does the patient experience mean? I've spent many years in healthcare, never really paid attention to it. And that's really what prompted us to take a look at the front office workflows. Even though this was an urgent care setting, I came back and, couldn't stop thinking about, all the billions of visits that happen each year and what their experiences are. Having to deal with a personal pain or a health issue, a scare. They could be with their parents, with their children, but this was pretty commonplace, right? To actually access one of the front doors of healthcare, dealing with a lot of anxiety, dealing with a lot of concern, but being greeted with something very inhuman as a clipboard and as a piece of information that we need to collect from you. So that's really what prompted us to take a closer look at how are patients accessing care in healthcare.
Yeah. Wow. Yeah. I love basketball. I don't love that happened to you, and, it's always great to speak to founders like yourself when there's a personal story driving like the mission of your company. And so fill us in a little bit about how this personal journey then led to you, or this personal story that happened to you led to you guys then at Yosi starting to help different types of practices. You just alluded to like this is the urgent care like ER setting, but from what I understand, you guys have evolved to working with different types of providers, independent clinics, pediatrics, like behavioral, virtual health groups. How did that come to be, and where did you guys decide to like start, and how did it grow from there?
Yeah, sure. I'll never admit or say that I'm glad this incident happened. But what we did after the incident was, uh, I ended up talking to hundreds of physicians, interviewed numerous front office clinic staff to try to understand what their current process is in terms of providing care to patients. This literally meant me visiting door to door to many of the clinics that I spoke with. In fact, some of our earliest investors were those physicians that I ran into by randomly walking into their office, trying to understand what does their front office workflow mean, what are the systems that they have access to, etc. So what it allowed me to understand and appreciate is that they had a tremendous amount of work that they needed to do before they could provide care to patients. So almost every single one of the physician I spoke with uh, was very frustrated in the amount of work that they had to do as clinicians, the administrative work, before they can see the patient or before they can provide their care to patients. So it was
Hmm.
very consistent across all of the physicians I spoke with, and that really prompted me to take a closer look at then, okay, what are the tools and technology that's available uh, that they're currently using, and why are these problems still not solved? Because you know we're the richest country in the world. Our healthcare spend is in the trillions of dollars, but yet the patient experience at the onset of them receiving care was pretty broken. How is that possible? So that's really what it allowed me to do by learning and listening to all of these physicians and their staff. We were able to pinpoint some of the reasons and the gaps that exist in the ecosystem. So
Yeah.
that gave us a really focal pain point to solve for at Yosi Health, where we wanted to look at the space and we wanted to understand, is this a prevalent issue? Is this a common issue? And speaking to these independent clinics and these physicians helped us arrive at the conclusion that this is way more common than we think, and this is not just contained to a few clinics because their technology stack is not up to par, or that they are slow to adopt to technology. So that's really what we concluded, and that allowed us to then start taking a closer look at next steps.
Yeah, no, it makes sense that springboarded you into literally going into clinics and offices and understanding from physicians like, hey, why is this happening? Like, I'm even curious if based on your experience, like the amount of like the percentage of offices that still use clipboards for like intake, because I can recall even going to my primary care physician, it's still all clipboards, like when I first went to him, and it's
Mhm.
pretty amazing. And I know Epic has done some work with like intake, right? And like I do understand that has made some strides, but do you know off the top of your head like percentages of practices that are, even from your guys' work, that still rely on clipboards regardless of the state or acuity of the patient coming in?
Mhm.
Yeah.
Yeah, sure. No, that's a great question. And, to this day, we still hear on a daily basis, literally daily basis, about practices that reach out to us because they're still using paper and they're looking to switch to a digital format. Even though the percentage has been shrinking, Bert, where now more practices have access to their to the tools that their EMR provides or to other systems that might be available, there's still a vast majority of them that use paper. The reason is because healthcare, is very localized, right? So it's not a one size fits all
Mhm.
that solves the pain points within healthcare, right? So that's really one of the biggest learnings that we had. The hundreds of clinics that I went and visited along with our team, uh, it helped us appreciate that each clinic, even though they might be of the same specialty, they still operate differently
Mhm.
than any of their peers or any of the other organizations. So the standardization is very difficult, to bring into healthcare because the physicians are different. They provide care differently. Their paperwork and requirements vary based on who they're contracted with. Their no-show policies may be different. Between an orthopedic specialist and a pediatric specialist, the amount of questions they ask are vastly different, right?
Right.
So that's really what helped us develop a deep appreciation that we need to build a platform that can adapt to the unique needs of these clinics and their workflows. So to go back to your question about how did we adapt our system early on, was recognizing that for every clinic that we work with, we almost have to give them a bespoke software that matches
Mm.
their workflows. And if we build a software that we say, here's the pediatric workflows and now adapt to this, we knew right from day one that it was not going to be a successful model.
Mm.
That was because that's really the current paradigm that's trying to solve healthcare, right? That one size fits all. Here's our EMR, here's the tool, here's the technology. Now use this to adapt to your practice.
Right.
One clinic might have a $45 no show. The clinic operating next door might have a $25 no show fee. Now, how does technology learn and adapt to all of that? Where simple things like that needs to be fully personalized and fully customized,
Right.
right? So that was our biggest learning, and that challenge excited us. And that challenge also convinced us that this is the reason why even some of these very sticky problems in healthcare are not yet solved. So
Mm.
it energized us to go after this problem with a lot of gusto, because we said, there's a pretty large market opportunity here that if we build software in a very thoughtful way, we'll be able to solve these problems and help improve patient outcomes. So that
Okay.
ended up being one of our key learnings from our initial interviews and engagement with the clinics.
I see. And you, in your work line of work, I'm sure have come across a multitude of different EMRs and workflows, right? And I understand like each practice has different like policies around no shows, whatever it be. But do you think the problem in this space, from what you've seen, is just not knowing how to adapt these digital formats? Like, do these EMRs provide practices digital formats for intake, and they just don't take advantage of them? Or is it, have you found like more a lack of intake workflows that meet their needs, or is it both? Like what is the problem that a lot of practices run into?
Yeah, sure. That's a great question. And, the answer is not quite as simple as, where the problem lies. It's a multitude of things, right, that need to come together in order for these large, complex problems to be solved in healthcare.
Hmm.
EMR companies, they've taken great strides in improving their technology, improving their offering over many years. That space is also very fragmented, with interoperability still being a major challenge for them, where patient information is not as easily or securely shared amongst different EMR vendors.
Mhm.
So, with that lack of integration, the medical record systems were built and designed for a different need than patient engagement. At least at the onset, they were built for managing the medical records. They were built for billing and submission of claims, etc. So because of those reasons and how they've been architected, it's very challenging for them to offer the type of personalization and consumerization that patients expect these days. And
Mm.
imagine an epic system that's serving thousands of major health systems, and each of those hospitals have hundreds of departments, right? They have different clinics, different types of outpatient clinics within the health system. And imagine the permutation and combination that a system like Epic needs to offer to match the unique needs of each of those clinics or the outpatient centers. It
Hmm.
just becomes untenable for them to provide the software layer wrapped around with the services that these clinics expect. So that's where companies like Yosi Health, that's architected on a scalable cloud-based system, can
Hmm.
not only offer the customization and the personalization that these clinics need, but because this is primarily what we do, we're able to offer and extend an exceptional support for these clinics using our software.
Right.
Epic's solving a lot of other problems, and intake may not be the primary problem that they solve for. And that's
Right.
true for most of the other medical record systems. So that's where a specialist like us, just like physicians, that's why we exist as a specialist in delivering that patient engagement wrapped with the workflow automation software that solves the pain points for the clinics we serve.
Right.
So
Makes sense.
we've seen EMRs continue to make great strides. They will continue to do so, but a complex, sticky problem requires a specialist to solve those problems.
Right. Right. Like said another way, the EMR EHRs, they're really good at the core of what they do, which is right all the way from the patient census, the visit, the diagnosis code down to billing. But it sounds like what you have seen is patient intake is often an area that has so much complexity, and then it's not really a core thing that's solved or complemented by the EMR or EHRs you guys interact with. And question there, I mean, is it safe to say you guys are able to integrate with most of the major like EHR EMRs in the market today, knowing that patient intake, you're you don't really, as a patient, you don't ask like, if you're not like a tech savvy patient, like, hey, what EHR EMR is my physician using? Unless it's like you're on my chart, and you're used to using Epic, right? Like it's very rare. But for you guys as the technology partner, have you guys been able to integrate with most of the EHR EMRs in the market by now?
Yes, Bert. So that space, while it's very fragmented, Yosi is today integrated with most of the major medical record systems, whereby we're able to bring the level of convenience and the personalization to those customers that use the medical record system.
Yeah.
And the way we've also solved for this is not look at patient intake as one pain point, but really look at the entire patient journey, right? Because a patient journey doesn't start or end with intake. So that's why we look at this very holistically, right? To say where does the patient journey begin, and what do they do before they see the doctor, during
Right.
their visit, after the visit. So we try to be very thoughtful about the solutions we add to look at that whole experience, from all the way starting with at home experience before they see the doctor to what happens between the visits, because there's a tremendous amount of care coordination gap that exists in our industry, where after the visit is done, it's still, yes, we provided you the care, but now you're on your own, right? Instead of the systems being thoughtful about, okay, this is what you came in for. Now, are you seeing the improvements? Can we check how you're doing? So
Mm,
there's still a tremendous gap there. So that's why we look at this as a patient care continuum journey and not just as a pain point for each of the experience that they interact with.
right. Right. Sounds like you guys have evolved from just looking at just intake, but look at the larger journey that the patient goes through. And oftentimes the first impression can mean a lot for a patient, right? It's like, wait, why did this physician ask me for this information? Like that I already like emailed or
Mhm.
faxed them through my other provider. Something as simple as that, it's the whole notion of digital front door.
Mhm.
It's like how do you create this like seamless digital front door for patients so that they're comfortable the moment they meet their new physician or practice. It might be a referral to a specialist that they've never met with. Those
Mhm.
impressions mean a lot for patients. It can mean the difference of them migrating over to another provider if they weren't happy with that initial experience they got. So
Yeah,
and
no,
on,
you're
on
absolutely correct, Bert. And that's really how we evolved as a platform. You're absolutely spot on. We started with patient intake as the main focal point for us to solve, because that oftentimes took about 14 minutes per patient. We
mm,
don't think about it as much, right? Because we've not measured it. We only measure it with the amount of frustration that we have waiting in a waiting room, right?
yeah,
But when we started measuring it, we identified that, a lot of simple things, right? The things that they ask you for when you arrive at a clinic, your insurance card and your ID. The reason they do that is they need to scan those cards to make sure that they have proof of record. So that takes something as simple as that, a minute, 2 minutes to scan. And then all the information that you would typically enter on a clipboard, someone has to enter all of that in the medical record system, including the detailed patient history, their depression screeners, or any other type of clinical assessment. So when we met with our initial customers. We measured, how long are you spending? Let's try to time this and let's measure this. And oftentimes we found 6 minutes that physicians were spending just on the information that a patient has already entered in a PDF form, just for them to reinforce the information that the patient has entered. 6 minutes is already wasted in that physician-patient interaction. And oftentimes, I'm sure you've experienced this yourself, the time that you have with your physician is very, very limited, right? So it's a very short visit. And, if it's 15, 30 minutes, you want to maximize the face time if you're a
Right.
physician with the patient. So a lot of that time savings could be, had with the patient intake, which is why we focused on that. And then we've evolved that into, let's look at all of the other engagements that the patient has and how can we as a technology partner play a role in improving those.
Yeah. Did you say 14 minutes on average per patient is what patient intake you've seen take?
Yes,
That's
that
like
is correct. When
that's
we
like
found
half.
out, we
Yeah.
were surprised by it as well, because we thought, how long could it take? It's a few minutes that we're sitting there in the waiting room frustrated. But
Yeah.
14 minutes, if you see 10 patients a day, that's
No, that
literally
adds
two
up. Yeah.
hours of time wasted.
Oh, and then for the patient, that's like half their visit right there. It could be that the difference of half their visit that could have been used for time with their physician, asking them questions and
Absolutely.
whatnot. Wow. Okay. No, I mean the storyline, the where what you guys are tackling in the patient journey makes a lot of sense to me. I'd love to learn a little bit more about how these different solutions that Yosi has. I understand it's more than just intake. It's pre-arrival. Telehealth is a piece of it. I also saw you guys just announced this month the launch of an AI voice agent. Can you tell us a little bit about how these different tools and solutions fit together through your platform to meet the needs of practices that you guys work with?
Mhm. Yeah, sure. Happy to, Bert. So, Yosi Health was the first pre-arrival focused patient intake platform. We were founded in 2015. And since our inception, we've always been focused on how can we make the waiting rooms more efficient, and how can we, patients are looking to access things at home, not, they're not thinking about their visit to a doctor's office when they arrive to the waiting room. So we've always been interested in how can we solve these problems where the patients are. And that's what prompted us to look into, okay, what are the things that a patient can do? What did they express interest in doing so before they see the doctor? And when we were looking for a comparison, we looked at the airline check-in process. Even though airline check-in and just the overall airline experience is not comparable to the type of experience we want,
Right.
it pointed us in a few directions, right? Where we're able to, get, book our tickets online. We're able to get our boarding pass before we get to the airport. And if you have TSA pre or clear or whatever you use, it makes your visit to the airport that much more seamless, right? Because now you can get through security and you can get to your
Right.
gate as quickly as possible, which is really what we strive to do. So by looking at all the things that we could get the patients to do, we found out patients were in fact looking for technology and tools to do those things. For example, we were surprised to hear that 83% of patients that were surveyed said we would prefer a clinic that offers the convenience of online booking. We thought there was, reason why clinics don't offer it. We'll get into that shortly, right? But
Hmm.
8 out of 10 patients want to book their appointments online. Yet 60% of the patient appointments are booked via phone, right?
Hmm.
So there's a clear gap right here between what patients are looking for and what ends up happening on the ground. So that's why we looked at patients, scheduling and allowing the patients to book appointments. We found out the reason it's not readily made available to patients is because patients do not understand, rightly so, how to book these appointments, who to book it with, what are some of the considerations, right?
Right.
That a clinic understands better. So by learning about all of this, we were able to design our software to match exactly what the clinic call center and their staff are trained to ask the patients before they allow them to book the appointments. So we were able to replicate the knowledge base of these clinics into our software. So our software became smarter because now it understood all of the things that the clinic staff understood.
Hmm.
So when we launched that, we had a tremendous impact on reducing the number of phone calls, allowing patients to book appointments online. And now that's once again 6 minutes that we saved per patient that was not on a phone call trying to book the appointment.
Yeah. I mean, those are incredible. I mean, if you could go from even like, well, 6 minutes in general. I mean, if you could just take 6 minutes out of the 14 minutes they spend on intake, that's a huge time saving multiplied by number of visits in a week, and
Right.
by, yeah, if you're a multi-specialty practice or a practice of multiple locations, there's an ROI there, I think.
Yep.
And I love this analogy though you gave of like the airline check-in process, because it's almost like the equivalent of, when you check in for a flight, like you have pre-check on your phone, you're not checking in a bag, but you go straight to security. It's like that can be applied to healthcare, whereby you're a patient coming in for a follow-up visit, you've already been pre-cleared by, your provider has pre-cleared with your insurance, and you should be able to get through that a lot
Mhm.
faster, like, and I'm sure there's multiple other examples, but
Mhm.
that analogy just stuck with me because there's certainly lessons to be learned there. And I think, you know, healthcare is much different than checking in for a flight, of course, and
Mhm.
hopping on board a flight boarding. But there's that digital experience can be,
Mhm.
parlayed on top of healthcare to create something that's meaningful for the patient and helpful for them,
Mhm.
but not everything, flights come with their delays, not
Yep.
everything is perfect. I want to ask you about what are some, you started to talk about this, but what are some of the common like barriers practices face when adopting technologies like yours? Are there certain like digital requirements that they need to have ready, like online appointment scheduling, like you just
Mhm.
mentioned, and how do you guys help them overcome those?
Mhm. Yeah, that's a very important question. I'm glad you asked, Bert. The first and foremost consideration for any healthcare organization is to make sure that the vendor of choice offers their platform in a very secure, HIPAA compliant method and manner, where patient data and privacy is protected at all times, and that they have the security that gives them the confidence that this company or this vendor has met the highest standards. So
Hmm.
that's what I always say as the first thing, right? That's just table stakes, so to speak. So once they've made sure of that, they all have the electronic medical record system that they use. So it's very important for them to make sure that the technology or the vendor choice fully integrates with their medical record system. And the word integration is also in healthcare thrown around pretty loosely. You
Hmm.
know this better than most people. You've spent a lot of time in healthcare yourself. So evaluating and making sure that the integration is as deep as what they need for their unique needs or their workflows. I think that becomes one of the key consideration. And then really the software itself, if they're purchasing a software, how can it be customized to my needs? Does it allow for me to match it against my workflows, because they are pretty unique? So
Hmm.
is this a software I'm purchasing off the shelf and I'm stuck with it, then I have to compromise on my workflows, or will the software adapt to all of these, right? And with any software, there's always going to be things that they might need. So that's where the last component, which is the customer success and support, comes in. Is this a company that's willing to listen to what my needs are? Are they taking the feedback? Is that now being put into their roadmap and being improved? So oftentimes, a lot of the CIOs and the CISOs and technology leaders for large health systems, they find it frustrating that a lot of what they're looking for does not translate into solutions that they need, right? So their hospital system that oftentimes uses 100 plus software partners.
Hmm.
So think about a CTO or CIO's challenge, right, of having to go through the same process with literally 100 plus vendors, but not knowing that there's a support layer that takes my feedback and improves my workflow. That's oftentimes, amongst all things in healthcare, lost a little bit because we don't hold the service and personalization and the experience to a higher standard than we should in healthcare, right? With other industry, with other aspects of our life, customer service is very important, right? If you call internet company, you place a lot more attention to experience than you would in a healthcare setup.
Right.
That's always very stark for me because of all the places, healthcare is where I should get the best possible experience.
Right, right.
Right.
You gotta
So
say that louder for the folks in the back, not
right,
holding service to a high enough standard. Like,
yeah.
that's absolutely true, and
So those are some of the recommendations I would make for anyone that's looking to make decisions, purchasing decisions, or how do you bring new partners into your ecosystem, to hold them to those higher standards, that they should deliver exceptional customer support to you. The system should be fully compliant, should be fully integrated, and should allow for the customization and the personalization that you need as an organization.
right. Yeah, well said. I mean, those are some really good, like, almost like guiding principles to keep in mind as you evaluate new patient engagement technology. Like, all those things you said are true around HIPAA compliance, EMR system you use, integration being tightly
Mhm.
or loosely coupled. You want tightly coupled and spot on. And
Mhm.
now, is there you mentioned a lot of different types of like practices and specialty areas. Is there a certain like segment or clinical specialty that you guys have found yourself digging into recently that excites you? Any stories or like real world impact that you can tell us about in a segment or a specialty too? I would
Mhm.
welcome your thoughts on.
Yeah, sure. While today Yosi Health serves a wide range of specialties, there are a number of specialties that we work very closely with because their needs are a lot more complex than other specialties. For example, for pediatrics or orthopedic care centers, behavioral health care centers, their needs in managing their workflows and the patient workflows are very complex. For
Mm,
example, with pediatric care centers, we literally create 1,500 plus unique workflows. And you might think, what are you guys doing? You provide a
yeah.
software, what do you mean 1,500 workflows? The reason we do that, Bert, is because based on the age of the child, right? The child could be 3 months old all the way to 16 years old. So
Mm,
based on different age and stage of the child, the care center needs different forms and questionnaires filled by the parent based on whether it's a sick visit or a wellness visit, right? So right there, you have a combination of 480 plus workflows just based on those two factors. Similarly, for orthopedic clinics, every specialist in the organization, for example, if you're a knee surgeon versus shoulder surgeon, they have different forms and questionnaires and pain assessment skill
mm,
that they provide, because my shoulder surgeon obviously asks me questions related to my shoulder than if I were to go for a wrist injury.
right.
So for these complexities, those are specialty clinics that we work very closely with because their needs are a lot more complex than other specialties.
Yeah.
And then with the onset of COVID, we've made tremendous progress in helping care organizations become fully virtual. So until then, a very small percentage of medical appointments were fully virtual. But COVID, prompted us to revisit how we think about care. And there's a substantial increase with virtual appointments. And because since our inception, we've always been focused on taking care of patients at home, we
Mm,
were aligned perfectly to continue to help organizations manage their entire virtual flow telehealth appointments. So we were in a fortunate place because we've been solving these problems since 2015. When COVID happened, we were already placed exceptionally well to support those organizations that were taking those appointments fully virtual.
yeah.
So that's another group that we've had tremendous success with. And lastly, concierge medicine and medical practices that tend to pay more attention and focus to patient experience. A couple of names come to mind. Privia Health is the largest MSO in the country. They pay a lot of attention to the experience that their patients have.
Mm,
And we've been working very closely with them with many care centers across different markets where our services are helping their patients get an exceptional experience accessing care. And by working directly with the Privia Health team, we're able to deliver our services to a wide range of clinics and their patients. So that type of concierge medicine where healthcare organizations are being very thoughtful about the experience they deliver to their patients, it's a great fit for us as well.
Those are all really good examples, Ari, of like how you guys have worked across peds, ortho, with Previa Health, even in concierge medicine. It's pretty amazing to hear how exactly, like, I mean, it really sounds like you guys like to dig into, you know, specialty areas that are complex, right? Like that's the value, the core value of a solution like you guys offer is that ability to cover those, you know, different workflows. And you said something else that really stood out to me, and that's that, you know, practices can really see this as enabling their full on digital, like first like environment with patients.
Mhm.
You know, like it's one thing to say, oh yeah, I can book, you know, appointment, or our patients can book appointments digitally, but it's like, okay, is the rest of your workflow digital, you know?
Mhm.
And it's like what you guys are doing in the market is enabling that beyond just like intake and the things we talked about. It's you guys are able to help promote this digital first approach, you know, with practices, which is going to become more and more important. I
Mhm.
mean, I think these concierge medicine models will continue to grow, and the need for patients to, you know, book things digitally or interact digitally is gonna, you know, keep growing that need. So pretty amazing to hear the work you guys are doing, and I love the real life examples you cited.
Mhm. Yeah, that's why we're very excited about and optimistic about where healthcare is heading. We see tremendous amount of scientific advancements in diagnosis and medical devices and pharmaceutical. So now, if you apply the healthcare software layer on top of those advancements, where the software is uh, you know able to personalize and deliver the type of customer experiences that they're looking for, but one that also solves the unique needs of each healthcare organization with multiple pain points they deal with.
Hmm.
The opportunities, looking at it from Yosi Health's perspective, is pretty exciting because we've solved for a few pain points today, but there's so much more wastage in healthcare. And when it comes to administrative burden, we are very grateful to all of the healthcare workers, team members, and employees that are in the front lines, where they do a thankless job, whether they are the physicians, the nurses, the front desk team, the operations team. Everyone's looking to do the right thing by helping the patient get better, but they're always dealing with a lot of challenges. So
Hmm.
that's why every single day it excites us that we're constantly looking at improving patient outcomes. We're looking at automating workflows so the system could be more effective and more sustainable.
Right.
Staff burden and human burden within healthcare is tremendous, and we all need to play our part in making sure that we are improving those efficiencies.
Right. Right. And these are almost the quick wins you could stack, you know, before you start implementing AI, you know, practices that are like, well, I don't even know how to start with AI. Like these are, in my eyes, the quick wins, you know, you can enable. Like these are things you should have already been doing years, or if COVID didn't prompt you to do this, now is the time to do it, you know, before you go and adopt it, you know, more complex workflows with AI. And on that point, you know, what's next for you and the team at Yosi Health? I mean, I know we spoke earlier about you guys recently launched an AI voice agent. Like, where are you guys headed next as a company? You know, now that you've catered to so many different types of specialties, where are you? What direction are you guys headed in?
Yeah, sure, Bert. So, AI is an area where that we're looking at very closely. It has huge implications for improving efficiencies within healthcare, and we're pleased to launch our first services based on AI, where we can help solve for the patient inquiries and phone calls that come into a practice, whether it's for a patient looking to book an appointment, or they're looking for information about the clinic, or they're asking for a prescription refill,
Mm,
looking for lab requests, whatever the request might be. There's a tremendous amount of burden placed on our healthcare system with these patient phone calls. And if it delivered the experience that patients were looking for, at least that would be a good win. But patients are usually always on hold. And, one fourth of the patient end up dropping the call because they've been on hold for too long. So imagine one out of four patient that picks up the phone, wants to speak to someone, and they end up dropping the call because they've been on hold for too long. So that's why this is an exciting area for us. to see how we can extend our services through the use of our AI agents that can
Mm,
take these calls, but we're doing it in a very thoughtful way that patients and our customers can trust the system. Where if we're not able to resolve an issue, we create workflows where the calls are immediately transferred to a human agent. So we're not adopting AI and applying it across the board, but we're taking a very measured approach of allowing the system to learn better and allowing the patients to be able to speak to someone should they wish to sooner than other companies would. Because while we're looking to solve for 70% of the phone calls to be fully handled, we're not there yet because we want the patients to have the type of experience where they can speak to a human agent. So that's why
right.
it's a pretty exciting area. And AI has a lot of other benefits and values that our team has been looking into. So looking forward to exploring ways to leverage these new technologies and to deliver the outcomes that we've been delivering for many years now.
Yeah, I love that metric you just said. 70, like the goal is to get 70% of patient calls to be handled by voice AI one day. Because certainly there's 30% of calls like
Mhm.
where things where a patient has an update on their condition, they need to speak to their physician
Mhm.
or a nurse, like, hey, something's going wrong.
Mhm.
Like those at the end of the day still need to be handled by a human, but there's certain more very low acuity things or not even any acuity, like, hey, I
Mhm.
just want an update on my lab or like I want a
Mhm.
prescription refill. Like, do you really need to be able to handle those all on a phone call back to back? Some
Mhm.
patients might argue yes, but I think overall there's certainly things that can be handled without a human on the line. So I'm
Mhm.
excited to see where those technologies head. We've spoken a lot about voice AI on this podcast, so I know my listeners, our listeners, have heard voice AI, and excited to see where you guys at Yosi Health take that moving forward. And with that said, for those practices that are listening, whether it's a pediatrics group, an orthopedic clinic, concierge medicine, and they're listening to this and they're like, I'm interested. I want to talk to the team over at Yosi. Like, what's the best way for them to get in contact with you guys?
Yeah, sure. No, we'd love to invite them to speak to us to help us help diagnose how we could bring about some of those improvements to their operations. So they can easily reach out to us through our website, which is www.yosi.health, or they can also personally reach out to me. My email is hari@yosicare.com. That's HARI at yosicare.com. Our team is on standby to assist any of the listeners that reaches out to us.
Yeah, and hopefully not a lot of folks that go through the scare you did of having a basketball injury and then having to go to their clinic and sign a bunch of paperwork with a banged up shoulder because it happened to you. It happened to me. I remember too when I got into an accident with my elbow, like, and I couldn't even move my right arm, which is my dominant hand, and I remember struggling to fill out paperwork. So it's very real, and I'm sure, like you said, thousands of patients across the country run into this daily with unfortunate accidents.
Mhm.
So yeah, personally excited to see what's next for you guys and continue to keep tabs on Yosi. And thanks for hopping on the podcast today and sharing both your personal anecdotes and the work you're seeing in the market. And we need more partners like you guys to continue, improving that digital front door for patients. So thanks for your work.
Yeah, thank you, Bert. I enjoyed speaking to you as well and look forward to connecting soon.
Likewise. Thanks, Harry.